Artificial intelligence is transforming the world around us, and nowhere is that transformation more tangible or more personal than in healthcare. To understand how deeply this shift has taken hold, imagine this opening moment. The voice you're listening to, the face on the screen, and even these very words were all generated by AI. It's a striking reminder that disruptive technology has arrived, not as a future promise, but as a force already reshaping how we work, communicate, and care for one another. But behind this digital introduction stands a real physician, Dr. Jonathan Chen, a Stanford researcher who has spent nearly 2 decades at the intersection of medicine, data science, and clinical operations. His mission is not to sell technology, it's to improve care, and his first-hand experience reveals both the need for AI and the responsibility that comes with deploying it. He begins with a hard truth. Millions of people in the US, and billions worldwide, lack access to a qualified medical expert. He recalls a young woman who came to his clinic exhausted, anxious, and with a racing heart. Testing revealed a thyroid imbalance. He referred her to a specialist, only to discover the next available appointment was 3 months away. Unwilling to let her wait, he turned to textbooks, digital references, and even a former classmate to ensure she received timely care. That single patient illustrates the global crisis. Modern medicine has become too complex for any one doctor to navigate alone. Tens of thousands of tests, treatments, and guidelines are published every year, far more than any human mind can process. This is where AI can truly help. But first, we need to understand what AI in medicine actually relies on: data. Unlike industries built on static documents or images, healthcare data lives on a timeline. A patient's story is a sequence: vital signs, labs, medications, clinical notes, imaging studies, all scattered across more than 1,000 digital systems. Even after assembling everything, no one has continuous measurements of all variables, and no 2 data types are recorded at the same moment. Medicine measures what's needed, when it's needed. AI prefers structure. Medicine lives in organized chaos. Once that chaos is structured, models can be built. And in healthcare, every model ultimately answers 2 questions. Should we treat? And if so, how should we treat? To understand how AI moves medicine forward, Dr. Chen outlines 3 levels of impact. 1. Advancing scientific knowledge. 2. Improving clinical practice. 3. Enhancing healthcare delivery at scale. A powerful example comes from heart failure with preserved ejection fraction, a condition once thought to be a single disease. AI-assisted analysis of imaging labs and gene expression revealed 3 distinct subtypes, each with different outcomes. That's scientific progress. But real change requires new diagnostic tests and tailored treatments, and then proving that those tools improve outcomes across entire health systems. Another breakthrough is the Green Button Initiative. Traditionally, it could take 9 months to review literature for a rare case. The Green Button compresses that into a single day by analyzing thousands of similar patient histories and returning a 2-page report grounded in real-world evidence. What once took months now happens overnight. In another project, AI identifies patients likely to die within 3 to 12 months, not to deny treatment, but to initiate essential conversations about goals and advanced care planning. Once a slow, multi-step process, it now reaches thousands more patients because AI was paired with redesigned workflows. The lesson: a model's value isn't in its accuracy, it's in the actions it enables. But AI isn't only classifying disease or predicting decline. Generative AI, tools like GPT-4, MedPalm-2, and MedGemini, has changed what's possible. Early models struggled to pass medical exams. Within months, new models outperformed the average physician. Yet medical tests don't measure what makes a great doctor: reasoning, communication, and empathy. When researchers gave GPT-4 the same complex clinical exam required of Stanford medical students, it scored higher than the student average. But when real physicians used GPT-4 during case evaluations, their performance only improved slightly. Why? Because the barrier wasn't the model, it was human adoption. The healthcare workforce must learn how to use these tools effectively. Some clinicians insist AI can never replicate empathy, but when Dr. Chen tested chatbots with emotionally charged, ethically complex scenarios, the systems sometimes responded with more patience and emotional clarity than humans. After the initial discomfort, he realized something important: AI could serve as a practice ground for difficult conversations. helping clinicians refine the deeply human skills essential to care. This echoes the famous idea: any doctor who can be replaced by a computer should be replaced by a computer. Not because AI replaces people, but because it forces us to understand what makes clinicians irreplaceable. Yet AI's story in healthcare doesn't end at Stanford. Across the country, new systems are emerging to solve different pain points. At Yale, researchers trained ECG GPT, a model that can generate a full cardiology report from a standard electrocardiogram, making expert-level interpretation accessible anywhere. But the most widespread impact may come from tools designed to fight information overload. Medical knowledge now doubles every 73 days. To read even 1/3 of the literature in their field, specialists would need 9 hours a day, every day. That's why Harvard-trained economist Daniel Nadler created Open Evidence in 2022. It doesn't diagnose patients. It understands clinical findings in research and retrieves the most relevant evidence within seconds. With 65,000 physicians joining each month, it's now used by nearly half of all US doctors. At Mount Sinai in New York, Dr. David Reich envisions a future where AI integrates genetics, imaging, and electronic health records into truly personalized care plans. Meanwhile, Nadler imagines AI connecting clinicians to experts across the country, quietly routing questions from one mind to another, like a modern-day operator. And in clinics like Dr. Samyukta Mulangi's in Tennessee, AI is already easing the daily burden. She may see 25 patients in a day, review countless notes, interpret labs, and still finish work late at night, what doctors call pajama time. Tools like Open Evidence help her reclaim minutes that used to be lost to administrative tasks. All of this progress echoes the history of transformative technologies. On one researcher's wall hang photos of a transistor, a camera, a telephone, and the source code for the World Wide Web. Each invention reshaped how humans connect, learn, and heal. Telemedicine, MRI imaging, and electronic health records all trace back to breakthroughs like these. Today, AI joins that lineage, not as a replacement for human care, but as a new instrument that amplifies human expertise, reveals patterns hidden in data, and expands access to high-quality medicine. The question is no longer whether AI will transform healthcare. It already has. The new challenge is making sure this technology remains safe, responsible, equitable, and aligned with the core purpose of medicine, delivering better care to every patient. This future is not theoretical. It's happening right now, one patient, one decision, one model, one clinician at a time.